Hello, this is Dr. Lucia Cagnes, board certified OBGYN, streaming from the beautiful Cape Cod in Massachusetts. Welcome to my YouTube channel about HPV infection. Today we're going to talk about how we are typically treating abnormal pap smear. Once the patient has been diagnosed with abnormal pap smear, she needs to be followed very closely with usually repeat follow-up every 4 months or 6 months or once a year until the abnormality has resolved. Surveillance is extremely important when we are dealing with abnormal pap smear, especially when it's due to HPV, because we need to determine the trend. We need to know if the pap smear is going to improve on its own or if the abnormality stays chronic. There is always a possibility, especially with HPV, that it will go dormant in the body. When the HPV goes dormant, the pap smear typically will show negative HPV. That doesn't mean the HPV is gone, it means that it's in dormant state, therefore it cannot be detected. We don't know for sure when HPV can become active again in the body. That's why it's so important to monitor the patient with yearly pap smear, even after the pap smear goes back to normal and HPV is negative again. Mild abnormality in the pap smear, like atypical cells of undetermined significance, is treated in different way. It's important to determine the cause for the abnormality. The cause might actually be found in a different pH at the level of the vaginal milieu. It can be a transient infection with, for instance, overgrowth of bacteria that needs to be treated. It could be hypoestrogenic state, like is found with a patient who take a birth control pill for a long time, birth control pill that has a small amount of estrogen in it, or patients who are menopausal or postmenopausal, and they may need to be treated with topical estrogen product. We usually try to address the cause, if there is one, for the atypical cells, and repeat the pap smear after the treatment has been implemented. We usually give at least a couple of months for the treatment to work before we can bring the patient back to the office to repeat the pap smear. When we are dealing with cervical dysplasia due typically to HPV, we like to add another procedure which is called colposcopy. During the colposcopy, the provider will look for abnormality at the level of the tissue of the cervix or the vaginal wall of the vulva. And once an abnormality has been detected, a biopsy is usually done. Colposcopy is more a diagnostic procedure. It doesn't really do anything to treat the condition. With the colposcopy, the provider wants to establish a better diagnosis since the pap smear is not 100% accurate. When we are in the presence of worse cervical dysplasia, like a moderate or severe dysplasia, beside the colposcopy, the patients will be treated in majority of the cases with another procedure that is called cone biopsy. There are different kinds of cone biopsy. This is a minimally invasive procedure that can be done in the office and is called LEAP. LEAP is basically done with electrosurgical current and is a procedure where a larger portion of the apical portion of the cervix is removed. With the LEAP or electrosurgical procedure, the tissue that's been removed most of the time contain the abnormal cells. So it will be a treatment for the abnormal pap because the abnormal cells have been removed, but will also provide a better tissue sample to establish a more exact diagnosis. When a cone biopsy is done with the knife, it's called cold cone knife biopsy. The biopsy is typically done in a surgical setting because there is high risk for bleeding and infection with the procedure. We reserve the cold knife cervical cone biopsy for patients who are very high risk of having already cancer of the cervix. So those are very selected cases when the provider suspect there may be invasive cancer at the level of the cervix. This kind of procedure is more invasive and has also more complications for the future, especially in a patient of reproductive age, because increase the risk of pregnancy loss in the patient. So is definitely reserved for very special cases. Another procedure that is done for advanced cervical dysplasia is the cone biopsy done with a laser, where typically a mild dysplasia of the cervix is treated with a cryotherapy. Cryotherapy is minimally invasive procedure, is reserved for very mild abnormality of the cervix, like a grade 1, where HPV is involved, and is a procedure where the superficial layer of the cervix is frozen with this nitrogen oxide, and the procedure is highly effective if the diagnosis has been done correctly by the provider, and we are indeed facing just a mild cervical dysplasia with no endocervical involvement. There is very little risks and complications with this procedure. It's very well tolerated. It's done in the office without any kind of anesthesia, which most of the time is not necessary, and carries a very high efficacy rate, treating this mild cervical condition 97 to 98% of the time. Another procedure that can be done to treat also the abnormality of the cervix, especially severe abnormality, is definitely the hysterectomy. Removing the uterus, I will remove all the abnormality at the level of the cervix and the endocervical canal. But it's important to remember that it does not preclude the possibility of a recurrence of the lesion. HPV can in fact come back and cause more problem at the level of the vaginal canal even after an hysterectomy is done. So having an hysterectomy does not protect the patient forever against possibility of a recurrence of the lesion due to the HPV at the level of the vaginal cuff or at the level of the vaginal canal. So even patients who had hysterectomy, they need to be extremely careful and continue monitoring for possible recurrence of the HPV lesion every single year even after the hysterectomy is done. Well, this concludes this chapter about treating abnormality of the pap smear. You can find me at my website www.yourhpvmdcoach.com. Please let me know if you have any question. And please stay tuned. I will talk to you soon on the next video. Have a great day.